What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, July 6th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and COVID's one of them. COVID never ended. You just don't hear about it very much on the news, and you don't hear enough about the other viruses that are out there as well. If I told you we're in a summer surge, or that H5N1 is out there, would you have known much about it? Probably not, because you hardly ever hear about it in the news. Alrighty, so if you're new to my channel, subscribe down below. Give these videos a thumbs up. The more you hit that like button, the more YouTube will push these videos throughout the algorithm. Let's go ambitious today. Can we try for 200 like hits today? I want to keep as many people informed as possible. Share these videos with anyone you know. Hit that notification bell and leave your comments down below. Alright, starting off today in Scotland. COVID cases on the rise. More and more patients admitted to the hospital, data shows. Coronavirus cases are on the rise, with more than 440 acute hospital admissions due to COVID-19 in the last week of June, figures show. Remember that, 444 admissions. That's quite a few, considering they had 1,153 people tested positive in the week to June 30th. What's that telling me? Well, that's telling me that not enough people are getting tested over in Scotland right now for there to be that many admissions compared to 1,153 people testing positive. Alright, H5N1 news. In Cambodia, they report another human case of H5N1 bird flu. This is the 6th case so far this year. The 3-year-old boy, who is seriously ill, was likely infected by a chicken. So this is not a good thing, and this is their 6th case this year. We just had a case in the United States in Colorado just the other day. Moving on now to more bird flu news. This time it is Antarctica. Scientists have confirmed the spread of bird flu in Antarctica, which has caused significant mortalities of wild birds and mammals on a global scale. So this is not a good thing. If you want to read any of these full stories that we give the headlines for, you can do so by going over to my Twitter account at COVID Data Report, and you will find all these stories I do retweet or tweet out these news stories. Alright, moving on now to Spain. Spain, 42.5% SARS-CoV-2 positivity rate in week 26. Wow, that is a really high COVID positivity rate, and you can see here it has been rapidly rising for many weeks now, and it just continues to do so. The percentage of positivity is 0 for flu, 0.5% was the previous week, but COVID again, 42.5%. That is just totally ridiculous. In case you did not see yesterday's video, the UK this week did report 3,230 new cases. That was up by 350, 12.2% rise, but not as big of a rise as the week before. They did not update the deaths. Healthcare vaccines did update. 62.3% took a booster, and testing positivity rate was 14.2%. Wow, we're going to see somewhere else here in the United States that does have a positivity rate approaching, if not in the double digits now. Taking a look at what's going on with the pollen levels today, and 56% of the country is in the low to medium status. We do see that there is yellow and orange on the west coast, the orange being in Oregon and up in Washington. In the east, we are in the green for today. That is some good news. Taking a look at air qualities, I can tell you right now, as this is refreshing, it's not going to be good. It is extremely hot here in the east today. There is a front that's moving through, and you can actually make out the front here via air quality. As you can see, western Pennsylvania is not as bad. Eastern Pennsylvania, New Jersey, Virginia is still pretty bad. That front, which is not really going to do much, it's still going to be over 90 for several days, is going to knock down the humidity and maybe clean out the air mass just a little bit. Great Lakes, you're in the yellow once again, and coming up to Canada, there is some oranges as well. Might be some wildfire activity starting up in Canada, and we do know wildfire activity has been ongoing in California, which is why there have been some days that have had really bad air qualities, and plus it is extremely hot right now in California. In portions of the desert areas, places west, or I should say east of Los Angeles, it's just a complete scorcher. Temperatures above 120 degrees. Temperatures are above 100 across most of the state, but some places are worse than others. Palm Springs, I did read yesterday, I believe was 124 degrees, or it was over 120 degrees. And heat index is higher, so yes, this is extremely dangerous heat. And the heat related illnesses, this map here that you see, it's not refreshing at the moment, but it will. It's going to only continue to get worse throughout the week. We're going to see the majority of counties on the West Coast report heat-related illnesses relatively soon. Take a look at the Northeast, up in Maine, New York State, Vermont, New Hampshire. Very hot up there as well as of lately, and that has led to a very high number of heat-related illness calls. They have had some breaks in between, but the number of calls, they're way up. Pennsylvania will start to fill in as well. We've been seeing a lot of ambulance calls here in Pennsylvania. Want to learn more about weather and climate? Well, I do have another place where I do that. It is Climate Data Report on X, and I do have another YouTube channel, but I did not post anything there today. We did not talk about Burl on there today. Maybe we'll get back to talking about Burl on there again tomorrow. Just need to take a break from that channel just for one day. But I will be tweeting on my X account about Burl this evening. I can assure you of that. Alright, I have to show you some really bad news now. We're talking about heat-related illnesses, talking about a summer surge. Well, when they go hand in hand, it generates a ton of ambulance calls in Philadelphia. Yesterday, Philadelphia had 955 EMS calls. Remember, I get concerned when it goes over 800. We're talking 955. We're not far away from 1,000 in one day at this point. I'm telling you, this heat is really dangerous. You need to limit your time outdoors if you're in an area that has the heat. And I can tell you right now, it is extremely hot here. Taking a look at Montgomery County. Respiratory emergency, multiple times showing up right now. Breathing difficulty calls do increase when the heat goes up. Taking a look at what's going on in Chester County, Pennsylvania. Wow, multiple sick person calls. Not one, not two, three of them, and a respiratory call. I mean, people do get sick. You can feel like you're sick when the heat is really high. So please, take extra precaution if you're anywhere where the heat is extremely high today. Walgreens positivity rate nationally this week for COVID is 36.5%. That's a difference of up 2.5%. Total test, 5,150 versus 4,601. Alrighty, let's take a look at Canada. And I did get a comment yesterday. Someone wanted to see more of Canada because, well, Canada's right next door. We're going to show you two things for Canada today. I did find something else. It's not much, but it's better than nothing. Number of sites showing an increase, 24. Number of sites showing no change, 25. Decrease, 11. High sites, there's now 4 of them. Moderate, 9. Low, 10. And new sites, which always comes up in the 30s, is at 37 at this time. Alright, taking a look at this map now from Canada. And there are different colors on this map which represent changes. And the darker the blue, the higher the levels are for activity levels of COVID at this time. And we can see here, when we take a look at the eastern sections of Canada, that is where the highest levels of COVID are at this time. And then we can see here there are a lot of provinces or regions that are just not reporting at this time. So it would appear to me that the eastern sections of Canada, like for example, if you're up in Montreal, COVID's higher for you right now than it is to your west at this time. Alright, moving on. Taking a look at what's going on with the wastewater here in the United States, and we do see the number of these orange and red sites. They're out there. We don't like to see them. That means there are high levels of increases. But one thing I can note to you is I don't believe this map has updated, and hopefully we'll get an update again on this on Monday. We'll probably still use it tomorrow for the wastewater update, but we'll also use other resources as well. We might even do a few individual city dashboards tomorrow. Chicago and maybe Houston are coming to mind right now for me. Alright, taking a look at what's going on now with the latest variants. We did get a variant update yesterday, and right now we're seeing that KP.3 still leads the way at 24.5%, KP.2 is at 21.5%, and LB.1 is at 10%. I do think we are going to see something else for the variants here in just a little bit from New York City when we get to that far down the line on my tabs. Taking a look at what's going on with hospital ER visits for COVID, and what can I say? They're increasing just about almost everywhere. They are decreasing, though, in Maine, Vermont, North Dakota, South Dakota, and Wyoming. They're also decreasing in District of Columbia, and they are stable in some places as well. So not everywhere is rising, but the majority of places are rising, and some are rising more than others. California continues to see a substantial increase, and at the end of this video, we'll be taking a look at California, which is not good at all. It's actually really bad. All right, let's take a look at what's going on here with the emergency department visits, and I'm going to click on all states. So we will see the charts here. Just going to quickly run through these. So nationwide, it is rising. Alabama, it's definitely rising at this time. Alaska, look at that. A peak is showing up for you. Arizona, seeing a slight drop at this time, which is a good thing. I'm glad that Arizona's dropping. Arkansas is, unfortunately, you're rising at this time. And California is still rising at this time. Colorado continues to rise. Connecticut, Delaware, all seeing a rise. District of Columbia, it's rising ever so slightly. Florida is the biggest one that we note for just a rapid rise. Florida is, it's not a good situation in Florida. There's articles floating around that the emergency departments are starting to get very crowded down in Florida because of the COVID increase. Georgia, seeing an increase as well. Guam, you're kind of bouncing around all over the place, but you're dropping at this time. Hawaii, we noted yesterday, Hawaii has peaked. Hawaii is dropping at this time. Idaho, not a big increase, but it's a slow and steady one. Illinois is seeing an increase, and take a look at this. That's starting to pick up the pace a little bit. Indiana continues to rise. Iowa, not really much of a rise, ever so slight rise, we'll call it. Kansas, just a slight rise. Kentucky, picking up the pace. Louisiana is really starting to pick up the pace. Maine is flat at this time. Maryland's starting to pick up the pace. Massachusetts is rising slightly. Michigan, just a very small rise. Mississippi, I think we could say you're picking up the pace. Montana was rising. Now it's leveled off a little bit. Nebraska, slowly starting to rise. Nevada was rising. Look at the most recent at the end. Maybe signs that's going to drop a little bit. We'll see. I'm being hopeful. New Hampshire is rising. New Jersey has leveled off a little bit, but mind you, Jersey has not been reporting data lately. There's been problems with that. New Mexico is dropping ever so slightly. New York continues to rise at this time. North Carolina continues to rise. North Dakota looks like it's starting to rise. Ohio's rising slightly. Oregon continues to rise. Maybe somewhat of a slowing there. Pennsylvania, not rising that much at all just yet. And Rhode Island is dropping some. South Carolina continues to rise at this time. South Dakota, slow rise. Tennessee, starting to rise. Texas is picking up the pace. Utah, slow rise. Vermont, not rising too much, just ever so slightly. Virginia's rising. Washington State was rising, but look at this. We may have found another state that is starting to peak. Possibly. We'll have to keep an eye on that. West Virginia is a little flat at this time. Wisconsin was rising, now you've leveled off a little bit. And Wyoming is it's going up overall, but kind of bouncing around at this time. Alright, taking a look at epidemic status. Not much I can say. It's growing or likely growing across much of the country, and some places are still stable or uncertain. Pennsylvania falls in that list. I've been following my state from day one, and one of the things that does happen here is we don't really see a big increase until the college kids are back in school. There's a lot of college towns in Pennsylvania, and those towns do grow in population, and they do a lot of partying at the beginning of the school year, and that's when we see a bigger increase in my state. But nonetheless, if we go back here for a second, you do note that in Pennsylvania, there is a slight rise for ER visits for people who are diagnosed with COVID at this time. I just think in August is probably when we'll see our bigger wave, and then September at some point is when Pennsylvania will start to drop like other places. All right, taking a look now at what's going on in New Jersey today, and I do believe New Jersey is reporting 255 people in the hospital today. Not sure what's going on here, why it's just freezing up, but the number that I believe I saw earlier was 255. Ah, here we go. It's finally coming up. Everything's acting a little bit slow. 255, 70 out of 70 hospitals reporting, 7 people on a ventilator in the ICU at this time. We do note that New Jersey has 25 people in the ICU, and discharges at this time. There are 30 people who have been discharged in the last 24 hours. New York State, 1,792 cases reported on the most recent update from yesterday, and their hospitalizations at this time did drop ever so slightly to 831, with 80 people in the ICU. I do think New York State will rise over 1,000 hospitalized people in this wave. All right, sticking with New York for a second. I found this little interesting chart that shows the spread of variants in New York City. And you can see here, this is really interesting. Now, this is pretty outdated. It goes back to the 15th of June, but take a look at this. LB.1 variant at the time made up 39% of the cases in New York City. I thought that was very interesting. KB.2 was 20%. JN 1.13.1 was 6%, and JN.1 was 33%. All right, moving on now. Colorado this week, you had an increase in the positivity rate. It was up to 10%, and the number of people hospitalized is up by 8 to 95. Take a look at LA. LA is not showing signs of peaking. LA's cases just continue to climb and climb, and now they're up to a 7-day average of 256 a day. I believe that's what it is here. Yes, it says here 7-day average. Yes. Testing positivity rate in LA is now up to 7.18%. The good news is hospitalizations, though increasing, they're not increasing as fast, so that is some welcome news. And deaths, it looks like an ever so slight increase in deaths, but nothing relatively alarming just yet. And their emergency department visits continue to increase. Wastewater was down ever so slightly, but the overall trajectory, going back to all the way since the start of April, has been higher in Los Angeles. And finally today, taking a look at California, and look at this. They do have the heat advisory for California. It's extremely hot in California right now. COVID deaths are down for California. The positivity rate, though, take a look at this. In the past week, it went up by 3%. It is now over 10% in California. 10.6% total COVID positivity rate. Wow, so it is really starting to get up there, and that's on a statewide level. Again, not enough people are getting tested. If you enjoyed today's update, because that does it for today's pandemic update, give this a thumbs up. Again, let's try and hit 200 like button hits. It would be the first time we've ever done it based on yesterday. I think it's doable. Let's see if we can do that. And of course, share these videos with anyone you know. Hit that subscribe button if you're new down below. Hit that notification bell to be notified when I do my latest updates. And of course, leave your comments down below. I always like reading your comments. I will see you all again next time. Until I see you again next time, stay safe everyone, and have a fantastic Saturday evening. Thanks for watching. Stay cool.